Upon entering the room, I would perform proper hand hygiene and place my gloves on. My name is Natalie Doral. I am a family nurse practitioner student at Jacksonville State University. Can you tell me your name and date of birth?
Stacy, 11/20/68.
All right, Miss Stacy, what brought you to see us today?
We just recently moved here, my husband and I, and I just need to establish care with a provider.
Okay, do you have any complaints? Anything bothering you?
No, this time.
Any recent fevers, weight loss, weight gain, chills?
No,
No difficulty passing stool or urine?
No.
Oh, okay. Are you allergic to anything?
Not that I know of.
No medications or seasonal allergies? Okay. Do you have any medical history?
Not anything other than migraines.
Okay.
Every now
Do you take any daily medications?
No, I do not.
No. Okay. Have you had any surgeries?
In endometrial ablation with a tubal ligation.
And with that ablation, you don't have any periods?
I do not.
Do you have any pertinent family history?
No, overall pretty healthy.
Overall pretty healthy. Oh, okay. Are you married?
Yes, I am.
Okay. Are you in the military?
No.
Have you recently traveled out of the country in the last 6 months?
We have not.
Okay. Do you smoke?
No.
Okay. Any street drugs or alcohol?
No, none of that.
Okay. Do you exercise pretty regularly?
I do.
Okay. And are you up to date on your immunizations?
Yes, I am.
Okay. And you get your annual pap smear and breast exam?
I do.
Okay. I've noted here that my patient is alert and oriented. Her posture as well, and she has equal fat distribution. I've just kind of been observing her as we've been doing this. I'm going to go ahead and go into the inspection of her head. Here I'm just going to note symmetry of facial features. I am going to palpate, also observe and make sure there's no balding noted. I'm just going to palpate for any tenderness. Also going to go ahead and palpate the mandibular and frontal sinuses, making sure there's no tenderness here. We'll have her smile, just to note facial features, and raise her eyebrows. I'll also test her jaw strength, having her open and close her mouth, and note that there's no locking here. We're going to go into the eye exam. Alright, here I'm just going to look at her eyes, noting that they're symmetrical, they're both round. I am going to test and see if they're equal to light. Both are equal. I'm going to go ahead and look here at the conjunctiva and the sclera, noting that they're moist and they're light pink. They're not white or reasonably red. There's no discharge coming from the eye. I'll then go in and look at her lens here. Alright, and then I'll have her follow my fingers. Testing for ocular movement, and I will have her follow my finger into her nose, testing for convergence. Alright, let's get there. I'm then going to go ahead and go into the ear exam. I'm going to inspect the exterior part of the pinna, just looking for any lesions, noting that there's no drainage coming out of the ear. I'm going to look in the external canal, just noting that there's no drainage there. I'll go in and look. Tympanic membrane is gray, not bulging. There's just minimal wax noted, which is normal for any patient here. I did pull the pinna up and back to inspect that tympanic membrane. We're then going to go into the mouth. I am going to look and inspect her mouth. I'm going to note that inside her mouth is pink and moist. I'm going to look into the back of her throat, look for any drainage, look at her tonsils and uvula. Okay. There's no drainage noted. Her tonsils are going to be graded about a 2. Her uvula is symmetrical, and there's just some space between the tonsils and uvula, which is normal here. I'm going to go ahead and inspect the lymph nodes by doing preauricular. No tenderness. Posterior auricular. Occipital's a little further back here. Tonsillar. Okay, and then you have your submandibular and submental here. You have your anterior cervical chain, posterior cervical chain. They're not really tender upon palpation. You can't really palpate those. We'll go ahead and go into the lung fields here. I'm going to go ahead and go to the back of her lungs first. But first I'm going to notice upon inspection that her chest wall is symmetrical. I'm just going to inspect her breathing a little bit here and notice that she's not using any accessory muscles. She's not having any problems breathing. Her lungs are flat. There's not concaved or anything of that nation. So I'm going to go to the back. Here, I'm going to just palpate, make sure there's no tenderness in the lung fields. And then I'll go ahead and check for tactile firmness. I'll have the patient state 99. Here, turn a little bit more. Let me turn the computer. Okay. Again, just state 99.
99.
Okay.
99. 99.
You're just checking for any vibrations there. And then we're going to go ahead and I'm going to check here for the expansion of the lungs. Just having her breathe in and out. And they're symmetrically expand here. I'll go to the anterior portion of the lungs, and I am going to listen with the bell side in 3 areas. All fields are clear on the anterior portion. While I'm here on the front side, I'm just inspecting her neck, looking for any jugular vein distension, any masses or the thyroid, and I know her trachea is even. I'm going to go ahead at the start of the cardiovascular exam, listen for any bruits in the carotid artery. There's no bruits, and again, we did do that with the bell side. For the cardiovascular portion of the exam, we are just going to go ahead inspect the chest, make sure there's no lesions noted. Skin color is normal for the patient. We will check capillary refill in the patient. We're also going to go down, make sure there's no balding noted anywhere. There's no lower extremity pitting edema. Here, I'm also going to check the pulses bilaterally in my patient. And I'll check the posterior tibia. They're about a 3+. And the dorsal. Again, that's about a 3+ on her dorsal on her left side, and then we will do the same on her right. Posterior tibial. And her dorsal. Alright, and those are about 3+ bilaterally. On the chest wall, we're just going to make sure that there's no heaves or any pulsations noted. We're going to go in and listen to a few points with both the diaphragm and the bell side. I'm going to start with the aortic point. Pulmonic. Tricuspid. And mitral. I'm then going to go ahead on the bell and listen for any thrills or bruits in the same spots. Alright. Here we're going to go ahead and move into the abdominal portion of the exam. I'll have my patient lay flat. I am going to inspect the abdominal cavity. I'm just noting no distension, no abnormal masses, herniation, and we'll make sure the umbilicus is midline here. For the first thing I'm going to do is just auscultate all 4 quadrants, listening for the bowel sounds. She has normal active vowel sounds, but we will take the bell side and listen for any bruits. No bruits noted. I'm going to go ahead and take this time to percuss the abdomen, listening for tympany, and then noting if there's any dullness over the liver or spleen area. is noted in all 4 quadrants. I'm going to go ahead and start palpating the abdomen. I'm going to start lightly. She can notice any tenderness. Any tenderness noted?
No.
And I'm going to go deeply and look for any masses. No masses are noted. I will have the patient go ahead and sit up. And I'm going to go to the musculoskeletal portion of this exam. Here, I'm just going to go ahead and palpate the shoulders, elbows, and wrists for any tenderness. I'll then go down to the hips, knees, ankles, and the spine. Here, I'm also going to inspect the spine, just make sure it's midline. There's no abnormal curvature, no tenderness noted. I'm going to go ahead and test range of motion. I'm going to have the patient, Miss Stacy, shrug your shoulders. You could just bend your elbows for me and rotate your wrists. If you want to just flex your knees outward and inward, and then rotate your ankles for me to make sure you have good range of motion. Alright, I am going to go ahead and test strength in the upper part. I'm going to have her pull against me while I'm pulling away, and then push against me while I'm pushing towards her, and just squeeze my hands bilaterally. Okay. I'll grade her strength about a 5 in the upper bilaterally. You would just push out and push in, pull in. It's about a 5 bilaterally in the lower. I am going to test her fine motor skills by having her close her eyes and take her finger. You can just use both hands. We'll start with your right and point it onto your nose with your eyes closed. Okay, and then if you would just do that with your opposite hand. Alright, and then if you would just stand up for me, I'm going to have you stand, and if you would take your left foot onto your right shin and rub it down with your eyes closed. And rub it down. Okay, and then do that with your opposite leg, right on left. And rub it down your foot. Alright, you can just have a seat back up there for me. And here, I'm just gonna check your reflexes. We'll do the brachial reflex on this side. Okay, do this one. And then your brachioradialis. Okay, and we'll do it on this side. And then we'll do bilateral knees. Oh, sorry. Alright. Good reflexes noted bilaterally in those areas. Do you have any questions about your exam?
No.
Oh, okay. And I will conclude this exam by taking my gloves off and performing hand hygiene.